So what are the advantages of 3D printing over some of the traditional methods? Well, it used to be that we would have to take that impression, send it out to a specific lab in order to fabricate the guides. The problem with that is a lot of the impression materials have a small window before they start to deform, and depending on how quickly the lab would get it and process it could lead to errors in accuracy. With the surgical printing of 3D guides, we can actually avoid all that because there's no longer that material shrinkage that occurs. The images that we get from the intraoral scan and the CT scan will not deform. And when it goes into our software that has been calibrated to the printer, we know that it's going to print it down to the micron level. This means that when we're placing the implant, as long as the guide is in place and is seated properly, your implant is going to be placed where we think it's going to be best for function and aesthetics. The second part of that is it's so accurate that we can make up for differences in anatomy. So for instance, it used to be we needed a passive fit in order to get the implant guides in. And if there was dental restorations or other hardware in place, we couldn't work around it efficiently. Well, now we can customize it for that and have these guides fit so well that they're not going to move, that we don't have to worry about any of the surrounding anatomy, and it's customized specifically to your actual application. This enhances the precision and prevents a lot of the operator error that used to occur from the the quality of the lab fabrication of these guides. What else is nice about the guided workflow is, for instance, if you need more than one implant, but they're in opposite areas of the mouth, we still have all that imaging in place. And all we have to do is switch it in the software. That means less chair time. That means you don't have to come in for a second impression. And that means in the future, we still have so much of your information in place. Why this is useful is, God forbid you have a complication, we can go through that and look at what could possibly have caused that and what we can do to rectify it. It also reduces a lot of the time that used to take place of going back and forth and having you coming into the office to decide what needed to be done next. All of this imaging and software can be done simply in office on our computers, and we have access to it wherever we are.